Hi, this is my video presentation of a clinical case that I thought was interesting and that I had in clinicals. So this was a 4-month-old female, a Caucasian female who presented to the clinic with her father for her 4-month-old well exam. Um, Her father had no concerns about her at the time. He said she was developing well, starting to roll over. He stated she was drinking about 6 ounces every 2 hours. They feed her cereal once a day. He didn't have any concerns about her, didn't notice anything different that he was concerned about for her. So on review of systems, he denied any recent fevers, lethargy, appetite, or activity change, no congestion or runny nose, no pulling at her ears. He denied any neck stiffness for her, no cough, increased work of breathing or wheezing, no nausea, vomiting, diarrhea, or constipation. No blood in her urine, no abnormal movements or weakness, and she's had no new rashes or lesions. She's not taking any medications at this time, and she's not allergic to any medicines or foods. For her history, she has no significant past medical history. She was 8 pounds, 2 ounces at birth via vaginal delivery with no complications. Apgars were 8 and 9. She has not had any surgeries yet and has not been hospitalized. For immunizations, she was due to get Pentacell, Rototec, Prevnar, and Hep B. And then we'll go into the objective part of her assessment. So vitals at the time were her temperature was 98, pulse was 122, blood pressure was 86/52, respirations 32, and she was 100% on room air. Her weight at that visit was 18 pounds, 2.7 ounces. She was 26 inches long, and her head circumference was 18.3 centimeters, which put her at greater than the 99th percentile for head circumference at her age. And her BMI was 18.9, which is a normal BMI. On exam, she was well appearing, laying down on the exam table, awake and alert, very playful. Her head, she did have some mild posterior flattening of the occiput. The anterior fontanelle was soft, flat, and open. No masses were felt on her head. Eyes had a positive red reflex. Her TMs were normal, no bulging, they were visualized, no erythema or discharge of the ears. Nares are patent, no rhinorrhea, normal pink mucosa. Her throat and mouth, her tonsils were without exudate or erythema. Her oropharynx was normal and clear. Her neck, she did have a head tilt to the left side. We were able to manually move her head and rotate it from side to side and up and down with no tenderness. She didn't cry out in pain when we did that. But just at rest, the head kind of always had this tilt to the left. Heart rate was normal, rhythm normal, sounds were normal. Breath sounds were clear bilaterally, no wheezing, no additional effort was given. Her abdomen is soft, round, no organomegaly felt, and she moves symmetrically with full range of motion, and her skin was warm, dry, and intact, no bruising, no lesions anywhere. So for her assessment. This was a routine child well exam with abnormal findings. And those abnormal findings were a diagnosis of increased head circumference. We diagnosed her with brachycephaly for the flattened occiput that she had, and then given the tilt that she had of her neck to the left side, we diagnosed her with torticollis. So for our plan for the patient, we placed an order for an ultrasound of her head. We placed a referral to physical therapy for torticollis, and then we placed a referral to craniotechnologies for the brachycephaly to have her head measured to see if she needs a helmet for reshaping. So we discussed with the father the need for each of the referrals and the need for the ultrasound of the head. We discussed with him further about increased head circumference, and we probed a little further about just making sure she didn't have any signs of increased intracranial pressure. So he denied that she had any lethargy, any vomiting, no seizures. And, he stated earlier that her development was normal. But he did state that the child has an older sibling that had macrocephaly, and then the maternal grandmother had a history of hydrocephalus. And so we just discussed with him the need for the ultrasound, and we did follow guidelines for that, as the AAP states that even if the patient has a normal development and the clinician has no concerns about any neurologic abnormalities, neuroimaging is still warranted, and ultrasound is a reasonable initial study in infants with macrocephaly, but they have to have an open fontanelle and no signs of increased intracranial pressure. And so our guidelines were followed, and the patient met the requirements to have an ultrasound done of her head, just to make sure that there's nothing causing increased intracranial pressure that could be causing the macrocephaly. I agree with the plan that we made for the patient. I feel that it was very thorough, just given all of our findings of macrocephaly, brachycephaly, and torticollis. Instead of just focusing on one of those, we focused on all of them, and I don't think I would have done anything differently, just because we addressed all of the abnormals that the patient had at the time. And we discussed at length with the father just why it was important that they follow up with each of those referrals that we made. Other than that, I think that is everything for my patient. Oh, one other thing, the child had the head tilt to the left, but we asked the father if he had noticed that, and he said no, but it was just very obvious that she kind of held her head to the left. So even though he didn't notice it, we went ahead and still moved forward with diagnosing her as torticollis. So that's it for this patient. I agree with the plan. I wouldn't have done anything differently. We followed all of our guidelines. So I hope that you enjoy listening about this clinical presentation. Thank you.